Causes of colon cancer are multiple. There are multiple associations with the development of colon cancer. Many of these are related to lifestyle factors such as alcohol intake, dietary factors, smoking, and the legacy that leaves upon an individual. For example, obesity is associated with the development of colorectal cancer. We're learning that there are genetic influences associated with colorectal cancer, and in a small number of patients, that is the sole reason that they develop bowel cancer. We're also learning that there is an interaction between the environment and the patient, and we're understanding that the interaction with the microbiome, that's the bacteria that lie in the bowel, may have some role in the development of bowel cancer. There are many symptoms that can be linked to bowel cancer. The common symptoms that would be related to bowel cancer include a change in bowel habit with an increased frequency of bowel movements, a change in the consistency of the stool with loose stools. We associate bleeding with the potential for an underlying bowel cancer, and blood that is mixed with the stool is the most concerning. There may be other constitutional symptoms such as weight loss, there may be abdominal pain, and in certain rectal cancers there may be pain in the pelvis or pain in the rectum, but there may also be a sensation of incomplete emptying of the bowel. There are various ways that colon cancer can be diagnosed, and in the majority of cases we perform a colonoscopy. There are other modalities, including CT colonography, that provide similar detail to colonoscopy, not only outlining the lining of the bowel, but also show whether the disease may involve other organs, such as the liver or the lungs. We may also use CT scanning to assess the extent of a bowel cancer. For rectal cancers, we use magnetic resonance imaging, or MRI. We also use other forms of scanning, such as PET scanning, to assess the extent and disease activity in response to treatment. And for certain rectal cancers, to help with assessing the extent of the disease, we also perform endorectal ultrasound. In some patients, we may even consider performing invasive assessments such as laparoscopy. Growths in the bowel can be benign or malignant. And when we say growths in the bowel, we mean a tumour. And when a patient hears that they have a tumour, they will often associate that with being a bowel cancer or a malignancy, a malignant bowel tumour. But there are bowel tumours that can be benign. Often these benign tumours are polyps. Some of these polyps will eventually produce a cancer. However, many do not, and can be treated at an early stage to avoid the development of a bowel cancer. There are some polyps that will never form a cancer, but their mere presence indicates that a patient is at a higher risk of developing a bowel cancer and should therefore be put in a suitable surveillance program. There are other rare benign growths in the bowel that are not polyps that do require further attention. Some of these are rare tumours, such as GI stromal tumours, carcinoid tumours, or otherwise, and these will require the attention of a colorectal surgeon. Bowel cancer is entirely curable if it is caught early. Where patients experience changes in their bowel symptoms, if they undergo prompt assessment by either colonoscopy or CT colonography, then we give them the best chance of picking up disease at its earliest stage. That said, even if they present at a later stage with their disease, it does not mean that we cannot offer them cure. But the extent of treatment is likely to be more significant. Surgery plays the most important role in curing patients with bowel cancer, and the majority of the treatments that we offer are centred upon surgical intervention. Surgical intervention is heading more and more towards minimally invasive intervention. We perform laparoscopy in the majority of bowel cancer patients now, And there are new and novel techniques that we develop at the interface between laparoscopy and endoscopy to offer intervention with those at the earliest stages of disease. For those with more advanced disease, we know we can offer extensive treatment, including extensive surgery, that gives them the best chance of cure.